And now, on the MedTech stage of Deep Tech Atelier in Riga, we shall talk about academia and business response to COVID-19 pandemic, mainly, of course, here in our homeland in Latvia. And my colleagues, my companions in this discussion, there are two persons right here on stage in person and two virtually. Let me introduce you to Professor Maija Dambrova. Maija is the head of Laboratory of Pharmaceutical Pharmacology at the Latvian Institute of Organic Synthesis. Hello, welcome, Maija. Dr. Andris Zeltiņš, head of the Scientific Council and group leader of Plant Virology Laboratory at the Latvian Biomedical Research and Studies Center. Sveiks, Andris.
Good afternoon.
Emīls Sjundjukovs, ladies and gentlemen, computer scientist. He's dedicated to healthcare and education. And also Dr. Andis Šlaitas. Andis, sveiks. Executive Vice President at MGI Latvia. Here we go, dear colleagues. 5 Latvians sitting together and talking English about COVID-19 in Latvia. So let me start with you, Dr. Zeltiņš. Your institution. What actually happened approximately 1 year ago, and how that pandemic, the start of the pandemic, changed the everyday life of the Biomedical Research and Study Center?
Okay, if you are asking about our reaction 1 year ago, I would say first activities regarding or connected with COVID pandemic were to start several projects with several companies from Switzerland with an aim to generate a new vaccine against COVID. Later, at the very beginning, our institute also started to think about COVID-related projects again. At the very beginning, without any money. Later, there was a special state program established aiming to cover different aspects of COVID pandemic. And today, we are proud to make public such a number. Our institute, based on, let's say, nearly 10 years experience in whole genomic sequencing. Now we are we have sequenced more than 2,000 isolates from Latvia. If we are considering that Latvia as a small country, we are on the top. It is
actually, as far as I know, Latvia was one of the first countries in whole Europe to start sequencing of SARS-CoV-2.
Yes, because
right?
Our the director decided to start work without financial support, based on existing support. And I have to stress that without previous experience, it would be not possible.
Well, yeah, but then Biomedical Research Center was the #1 institution in the country which had the most experience in DNA sequencing.
Yes, as I said, they had nearly 10 years in next generation sequencing.
Perfect. Maija, if I may ask you, the Institute of Organic Synthesis and your department, did anything change in your daily life after the start of pandemic, except that masks, isolation, and things like that?
To be honest, a year ago, I did hope that Latvian people living here are very special and they are not getting COVID to that extent than the rest of the world, because the incidence of COVID positive cases was very low.
At the beginning, it seemed very promising.
But then, of course, this good feeling went away, and very similar to what already Andris said, also in our case, we have been working on basic research projects for quite many years. And when I talk to not scientist public, I always say that we know that we have to pay tax to be sure that emergency come when we have health problems. And now with COVID situation, it became very obvious that you really need basic science and scientists doing different things just in case if you need something very quickly. Also in our case, so the strong parts of our institute, it's medicinal chemistry projects. We look for new drug targets, but for COVID and really people getting sick and dying all the time, then the idea was to start with something that would provide results quite fast. And so we looked for compounds that are already produced in Latvia, that are related to COVID, not as a virus, but those post-COVID bad feelings. And I would say that at the moment with internationally known drug meldonium, we are sure that we can help, especially for those who are having this so-called long COVID, to fight the symptoms that are there after the virus is gone from the organism.
You are both active scientists, and normally you are spending most of the day in the laboratory or at your computer doing things. So with the start of the pandemic, when it was suggested that everybody should work distantly and the schools were closed and most of people who were able to do so stood at home and tried to do their work duties from home. What about you? Did you try to do this, or you just kept on going to the laboratory?
Okay, actually, as you can imagine, to do molecular biology in a kitchen would be not possible. Therefore, of course, we continued our work in laboratory, probably even more intense than 2 years ago. What we changed? We wear masks, we wash hands, we try to keep distance.
Try to keep the distance.
Okay, laboratory rooms, we cannot keep this rule 25 square meters for a person. As soon people finish their work in the lab, I asked colleagues to go home and summarize the results from home. But actually, I have to say, distant work was not possible. And I can say that actually since the start of the pandemic, we are working even more intense than usually.
I see.
The same in our institute, and I appreciate all the IT technologies that are there to help to keep distance. And I think that this international collaboration, and especially meetings that would maybe take several days to go somewhere and meet people, of course it's more fun in that way. But on the other hand, we have learned how to use technologies really to even follow. For example, we had mitochondria experiments where experiment was like pipette and all the experiment was in Riga, but data on the same time were analyzed in Austria. And this is all thanks to this possibility to connect expert and somebody, a researcher who maybe is not that theoretically strong to explain what's going on at the same minute when experiment happens through the IT technologies. So again, if I want to be positive, not COVID, but just positive, then new technologies and this distance and hybrid ways of working, they really, I believe that it will help, it will stay there and will help to get positive impacts in environment protection.
Yeah, every cloud has a silver lining, let's put it this way.
Yeah, let's try to see it.
So, ladies and gentlemen, Dr. Zeltiņš and Dr. Dambrova, they both represent scientific institutions, which are state institutions, but our other colleagues, Dr. Šlaitas and Emīls Sjundjukovs, they are coming from private enterprises. Now, Dr. Šlaitas, what about you, the institution you are representing? How did you have to react to the pandemic approximately 1 year ago?
Yes, well, for me personally, it was quite an experience because I left mainland China 3 days before the border closed, and I was starting to hear news of this new virus emerging. So actually, the initial months, it was more, as you all probably remember, there was a waiting game for things to happen, and the first half of the year was actually not very much different than previous.
May I interrupt you just for curiosity? The place in China you were located, is it close to Wuhan or?
No, it was Shenzhen. So that was Shenzhen. That was close to Hong Kong.
Okay. Sorry.
But yes, but we have factories. We have factories in Wuhan, and in fact, there were people visiting the headquarters from Wuhan, and they were very worried that their travel and their holidays will be disrupted. So as you all remember, the things started getting more serious with the first infected people, and in fact coming from Italy and so on. So it was a careful waiting game, I think, to see how this will develop, how will this affect us. So I think the real changes in work routines started much later in the year when we saw these huge numbers going up, so-called second wave when arrived.
Okay. Emīls, there are at least 3 companies listed for me that are connected with you. You're a co-founder of Longenesis and Coatum and also DF Lab, right?
So yeah, basically 2 hats I wear mainly. One is industrial one, so I'm a chief technical officer at Longenesis, which is the biggest digital health startup here in Latvia. And as well as Andis outline, so I left Singapore 3 days before the borders were closed. And that time, basically our distributed team, so all Latvians, but distributed among various clients, one Stockholm, Australia, Singapore, European countries, where we transformed a little bit ourselves to keep up with the regime and rhythm, because for the healthcare space, it meant that, especially after 3 or 4 months, everyone started to speak about digitalization. And basically, speaking of our track record, so basically we in March last year, we have launched and helped to run phase 3 clinical trials in the Middle East by using our digital both consent management tools and biobank registries systems. Plus also now we're actually serving one of the governments in the Middle East to run population genome program, also digitally, or the whole digital part. So, for us, it meant that we started collaborating and opened up another vector, because no one thought about, COVID, especially like December 2 years ago. We haven't thought about, the way that we will be applying our tech so much towards that, because we're not doing, any testing, any lab equipment. We're fully digital end-to-end solution providers. But basically, speaking of Latvian footprint, and another hat I wear is University of Latvia Faculty of Computing, and collaborate all together to pilot several technologies within the National Research Initiative, and also looked into the ways how we can not only provide digital tools, as previous speakers meant, to accelerate vaccine discovery or any other clinical trials, clinical research pipelines, but actually how we can engage population in the research. And we've piloted in Latvia and together with Israelis and US, Boston University, the pilots, how we can engage broader population in both risk assessment, risk triage, but also engaging them in connecting with the scientific groups all around the globe to study, to engage them in prospective studies in related to COVID, any other, how it affected any other risk factors, etc. So yeah, long story short, it was a hard year. We worked a lot I think, as well as all of the speakers here.
And if I may ask, which are the institutions in Latvia you are collaborating with?
Okay, so we do collaborate with Šteinbergs. We were speaking about the national and research and academic institutes. We have collaborated on COVID-19 data curation to help in real-time identification of data that you need for the research with the University of Latvia, BMC, RTU, Riga Technical University, Šteinbergs Hospital, Children's University Hospital. So basically, a lot of them, we do provide our competence there. But mainly, speaking on commercialization-wise, for sure, we focused ourselves on helping also institutions abroad. And one of the, kind of success stories, I think, especially for the rather small team in Latvia, is to help accelerate a nationwide genome program in the Middle East as well. So it was a good story for us.
Okay. Andis, if I may ask you, your company is also collaborating with academic institutions in Latvia, right? Especially in the context of COVID-19.
That's right. As it was mentioned, there's two sides to this story of early sequencing, and I mean the reason we were able to sequence so early is that there was a special program launched within the group, within the BGI group, that provided significant investment in COVID research, helping early detection and early identification of these variants. So in exchange for open public access. So this is I mean, the largest collaboration, obviously, that we have in Latvia is with BMC, and that's been going, of course, a strong way before the COVID started. Now with COVID, there's of course a lot of new things that we can do there, and so we're very happy that the most of the sequences obtained are actually on instruments that are manufactured by us. So there's a lot of learning, I mean, from this year. COVID, of course, has been a negative in aspects that some of our previously, very beloved and well respected products were not selling so good anymore because the research shifted. But I think we're very successful in repurposing actually existing equipment and existing applications to actually work for COVID detection and also, for research. So it's been really, I think, from the for this audience, I think it would be interesting to see how we changed our existing product portfolio and adapted it to the changes that the market was demanding.
Earlier today, here on this stage, there was a nice sentence said by Ashkan Fardost, the first speaker of today, and he said that the COVID pandemic actually showed how important the collaboration between different institutions is in the whole world, and also how important the digitalization of everything is, meaning that when the first SARS-CoV-2 viruses first isolates were sequenced in Wuhan in China, the researchers that did it, they shared the information digitally all over the world, so that scientists in other continents were able to start thinking of producing a vaccine against this virus, even a long time before the virus reached that particular continent, let's say. There was no SARS-CoV-2 virus in the United States, but the scientists were already able to plan the vaccine production against this virus. If I ask you, has this pandemic accelerated the collaboration between different institutions here in Latvia. Would you agree with me, Maija?
I could certainly agree for year 2020 when we had this state-funded research program, and at the moment we are in the process of publishing results, so it's still ongoing. I don't know how it will be in future, even though now we had some time to consider new project proposal applications and so on. I think that one thing is this collaboration among like basic research or state research institutions. The other thing is collaboration with industry, and really the industry and the business partners, they can't really keep ongoing different kind of activities just in case that in 10 years some new challenge will come. I think that this is why we need really this decent level of research where people from business can come with their questions. And this is something that happened to my lab and our researchers several times during previous year when there were quick questions from industry side, and we had in place models where to test their ideas quite fast. And I think this is very important to remember in future, that even if today your model is just something fancy to be published in the best world's journal, tomorrow there might be a business partner that needs this model to test their ideas and to save people's lives.
Again, the same thing about the silver lining, right? Andris?
Yes, of course. Corona pandemic is very stimulating for people who are developing different vaccines. We have already the fourth contract with several companies from Switzerland. We are developing virus-like particle-based vaccine against COVID, and seeing that how this COVID story develops regarding mutants, regarding limited production capacities. Our partners also we believe that actually there's still place for new vaccine, and at the moment we are working elaborating laboratory technology which would be easier to transfer to the producing plant.
Anything new about this project, or it's just...
Actually, it is listed in World Health Organization list of candidate vaccines. It is under company name Saiba. It is listed based on one plant virus, on cucumber mosaic virus, on virus-like particles. We introduced a piece of coronavirus spike protein into VLPs. As I said, we are now working to establish simple production technology.
There was an interesting meeting recently in Latvia. High official, I don't remember his exact position, from the European Commission came to Latvia to discuss the possibility that anti-COVID vaccines could be produced in Latvia. That we could open let's say a plant that could produce the vaccines. Is your research, and this question goes also to our partners, to Andis and Emīls, is your research in any way connected to this possibility?
Okay, no, as this project is financed by Swiss companies, of course it is a question to them. But I think a good contract manufacturer will always get orders. It means it makes sense to start such a project. Of course, it costs a very huge amount of money.
Okay. Andi, the previous question, same question to you, about the collaboration between private institutions and academic research institutions in Latvia due to pandemic. What do you think about it?
I mean, this is probably the sort of, it's a natural way for such collaborations to exist and to work. And I would like to say, you know, as Maija said, you know, research is a fantastic thing, and you publish it, and this is for a scientist truly the achievement. However, I mean, if this can be made into a product, commercialized, and you know, for the benefit of certain groups of people or humanity in general, I mean, I think that's why we are here today.
But did it increase the business you are doing, the collaboration between your, let's say, daily work and academic institutions in Latvia? Did it boost it or
absolutely.
not?
Absolutely. I mean, there's a lot of sort of there's main projects, main ideas, you know, as I mentioned, you know, looking at mutation variants and so on. But there's so many sort of other ideas, you know, how scientific mind works. I mean, you're a scientist too, so
ex-scientist.
You know, things you know, the brain starts to work, you know, and you start to get ideas, and many projects are created and ideas are created, and I think this will create projects for years to come, you know, and you know, activities that will, not all of them, but definitely will lead to something useful in the future.
Okay, thank you. I would like to ask actually all of you, but before that, Emīls, same question to you.
Yeah.
The things
Sure.
you are doing on a daily basis, will the pandemic boost your collaboration with other institutions?
Okay, good question. Totally agree to Andis. Would crystallize 3 lessons learned or call to actions there. So first and foremost, it's in regards, especially speaking about tech. For sure, it fostered and accelerated the amount of collaborations, but nevertheless, I more often hear the word that, you know, technology would solve something, and I would urge, you know, people to think a little bit vice versa, so not technology driven, but actually problem solving driven, and technology is the thing to solve the problems, not vice versa. So a lot of buzzword about, you know, digital tech helping and changing our lives, not thinking about, you know, first and foremost the business process and then applying IT to that. But two lessons learned very quickly and call to actions there. First and foremost about scientific collaborations. That's very cool that we have had National Research Initiative. We moved forward with collaborations. I think what we should work on, and the pandemic clearly showed us this, is science communication and citizen science as well, because what Andis crystallized as well, that not only we need to bring something tangible, but actually in this situation, citizens were, you know, waiting for something tangible to come. So they're not so much interested into, for sure, publications is a good KPI, but in parallel with that, we should, you know, close the gap between these 2 islands of population and scientific population. And the second of all is actually, yeah, scientific results, and I forgot the third call to action, nevertheless, but yeah.
Okay, never mind. We've got a couple more minutes, and very briefly, if I may ask you, all of you, do you see the light at the end of the tunnel? Okay, we can sequence all the new variants of SARS-CoV-2 and establish new mutations and adjust the vaccines endlessly, right? But do you see the end at the light of the tunnel? And how do you think, when will this end and we shall be able to return to normal life? Maija?
Again, silver lining. Yes, I see the light somewhere. Summer is coming, and I hope that numbers will get lower. But as a professor, I see my mission in teaching students in a way that they are professionals. Either they will work in business, industry, pharmaceutical, whatever, or they will be researchers. And the other thing is really to talk to public, not to get angry that they didn't learn enough of biology in the school, but try to find the right words so that people are more ready for vaccination, for participation in citizen science projects, for being realistic people in this very changing world every day.
Thank you. Andis?
Yes, I mean it has to get better, doesn't it? I mean, and I believe we are on track. I mean, we can be dismayed by the lack of immediate progress, and you know, as human beings, we often are impatient. But I think we have the ingredients for actually getting out of this.
So you're optimistic. That's great. Emīls.
Yes, I think I would, urge people to remember that history is cyclic, and we think about something that's, it will be for sure more positive. I totally agree with the previous speakers. But what I will urge us to think about is, how to basically look at this as a lessons learned. So my previous experience in the same Singapore, for sure, pros and cons everywhere. There's nowhere greener grass on the neighbor's yard. But nevertheless, what they did after the first pandemic, which was the SARS pandemic back in the days. So they urged to create a pandemic plan, which basically helped all of the stakeholders, both private, public, to understand how we should change our behavior paradigms in order to react accordingly, because this won't be a last pandemic for sure, and let's use this as a lessons learned.
Okay, thank you. Andris?
I don't believe that the virus will be eradicated in few years. But I think seeing these efforts over the world, I think we will learn how to live and how to manage the virus. And normal life, I would agree with experts saying 24, 25.
Thank you. Ladies and gentlemen, unfortunately, time's up and we have to end this discussion. Thank you so much, all the four of you. It was really an honor and pleasure for me to talk to you today. We have a break now, ladies and gentlemen. See you back on the MedTech stage in approximately 7 minutes. Okay?